Good afternoon or good morning, everyone. My name is Karen Llanos, and I am really excited to talk to you about telling the effective Medicaid story through the Medicaid and CHIP scorecard. I am the director of the Medicaid Innovation Accelerator Program at the Center for Medicaid and CHIP Services, which ultimately means I am the director of the Medicaid and CHIP scorecard. When I think about how to tell an effective story about Medicaid, the first thing that I think about in my mind is data. What data do I have available? What data do I have access to? What can I use to start telling something about my program? And the good news is, when it comes to Medicaid data in particular, is that we have collectively done a lot over the past couple of years to make that question have an answer. So we have been, and when I say we, CMS in the states have been really busy collecting and using quality measures in many different ways for many years, way before the past 10 to 12 years, but really at the beginning of the Affordable Care Act and the CHIP Reauthorization Act. Those two pieces of legislation signaled the beginning of standardized reporting and collection to CMS. And that was a lot of the work that I did when I first came to CMS, and was really exciting because that meant that states had the opportunity to voluntarily report standardized data through the child core set or the adult core set into CMS. And now we're moving, many years later, we're moving to mandatory reporting for children and behavioral health. And what all of that means is that the incredible investment of time and money and all sorts of resources, IT resources made by states and CMS, allows us to have more availability of Medicaid data than we ever have before. And that means that we can start piecing together what our story means. I know you all have a handout, but one of the things that I wanted to just highlight are some of the Medicaid data available at CMS that I like to go to. So the child and adult core set chart packs have a lot of information about healthcare quality measures that are voluntarily reported into CMCS each year. We have tons of data related to or based off of the TMCS analytic files through something called the DQ Atlas. And that allows folks to go in and really get into the nitty-gritty of the data through the TMCS analytic files. And then we've got a bunch of other information, but I've got performance indicators also highlighted because this is one that has a lot of information. It's updated pretty regularly, and it is enrollment data for Medicaid and CHIP. Lots of information that we like to pull in. These are just a few examples of what's available, but with this availability comes lots of opportunities to say something. As I said, to start piecing together different types of Medicaid stories. One of the ways that we are piecing these things together is through the Medicaid and CHIP scorecard. So this is an initiative that we developed and started in 2018. It is essentially a public reporting tool designed to provide a lot of transparency around some key metrics for the Medicaid and CHIP program administration outcomes. We want this information to lead to improved care for our Medicaid and CHIP beneficiaries, but also drive improvement in things like federal and state program administration. We've got lots of data in the scorecard, but really are using this to try to reflect the Medicaid and CHIP program or some key aspects of it. So we have over 50 data points and measures that are updated annually. This is really, if you don't know about the scorecard, it's a centralized way or dashboard where anyone can go in on Medicaid.gov and see how CMS is leveraging a wide range of state reported and CMS generated data. So we display data in 3 different ways. The national or background context, and that has kind of things about the program at large, the Medicaid and CHIP program at large, and you can look at it both state specific and from a national view. We have a handful of healthcare quality performance metrics, which is really state-specific quality metrics we pull from some of the resources that I just talked about. And then we have a pillar called federal and state accountability. That tends to hang at the national level and reflect different administrative points and measures. And this is just a few examples for folks that aren't familiar in terms of what's in the scorecard. So we took, when we were trying to figure out, we knew we could not reflect every single measure and data point that CMCS has available for Medicaid and CHIP. So we wanted to reflect at a higher level, right? What is the story that we can say about some key metrics across our program from a CMS perspective? So we pulled quality measures from the child adult core set. We have several measures from what used to be called Nursing Home Compare, but is now called the Provider Data Catalog. We have that background section, so about the Medicaid program. So key performance indicators on enrollment and eligibility. We pull from TMSIS, so we've got per capita expenditures and share of Medicaid and CHIP population by age. And this year we're introducing race and ethnicity and gender. And then finally, some administrative data that we used to release through informational bulletins, but now are putting here. And that includes managed care capitation review rates, how many states are using different types of experience of surveys for LTSS or long-term services and supports, and then some state plan amendment waiver processing times. So lots of different data that isn't necessarily new to Medicaid.gov, but we were trying to patch together the story about our program and bring attention to some key metrics. And I think one of the really interesting byproducts is, again, this was a lot of this, majority, I would say 90%, was information that we had shared through annual reports or reports to Congress, informational bulletins, really releasing these through different vehicles. But and I can say this because I worked on the child and adult core sets for many times and released lots of different reports to Congress. Not a lot of folks were reading those materials. It wasn't until they saw our key users saw all of the information put together in a unique way where you can actually see different states together on some key metrics that drew a big impact and drew attention to it. So the biggest lesson here that we learned was, just because it's posted online and your data are posted online, you think everyone's looking. They're not always looking, or they might not actually know where to go for the data if you've got a complicated website. So they might not know they exist, or they might need some additional functionality to that website in order to understand how to interpret the data in those reports. So, this is something that we always think about as we're updating our scorecard and trying to figure out what is the story that we're telling. How do we know if what the information is, once we put it online, is it useful? So I will just share that we have really kind of leaned completely into user feedback regularly and asking them, is this helpful? We work with everyone who owns data internally at CMS about what you want to add, Medicaid data at CMS, in terms of what you want to add or what you want to change or suggest differently. And then we spend a lot of time with our key partners at the National Association of Medicaid Directors Scorecard Advisory Group. From the beginning, they helped us set the vision, the direction, the messaging, the types of measure changes annually. They provide feedback into site functionality, and they have been integral to the success of our scorecard. So it is really helpful as you're pulling together your data to continually ask the key users, is this helpful? Can you actually understand what we're trying to share online? Is it really telling our story? Or is it just an exercise in posting information? And a quick example is, we didn't have, when we designed the scorecard initially, we only had two pillars. We had the healthcare quality performance pillar, and we had the federal administrative accountability pillar, but we did not have anything related to the background. And the advisory group was very insistent that if we're going to talk about Medicaid and 56 different Medicaid programs, we needed to include data on the size of the program, the differences in the variation between the programs, so that when you are looking at quality measures or some of the administrative measures, you're really understanding the full breadth of the variation that occurs from Medicaid program to Medicaid program. So we would not have had a really great background section at all if it wasn't for that feedback. So again, we meet with our users every year in different ways. And this is a quick slide that just shows, as we went into a huge redesign, our first redesign since launching, we asked different types of groups. We asked Medicaid staff, all levels, advocacy groups, and other different types of users. And we started building use cases. So how do you use the scorecard? Do you understand? We would really ask easy questions, go into the site, try to find this one measure. If they couldn't, then that meant that we had issues with just getting to the data. If they found the measure but weren't sure what the buttons meant or how you could actually start digging into it, that meant functionality. And really what we walked into a large redesign was more filtering, more the ability to look at trends over time, and lots more detail than we thought would be helpful for folks. So I'm gonna pop out of here real quick and give you a sense of our new scorecard. This is the redesigned scorecard. So for folks that are not super familiar, this looks different. We are calling things differently. Just for the sake of time, I'll just hop into how we have taken the background section, which used to be much smaller, and designed it into different types of care delivery, data, a data section to support program improvement, a whole section on eligibility and enrollment and expenditures. And then the two other pillars remain: federal and state program administration and healthcare performance. So I will just quick demonstrate one measure just to show in terms of how we are looking at, or how we're designing the site in a way that helps further the Medicaid story. So every measure will have a little card. You can quickly see that the key metric is for the most recent year that's available right now, which is January to March 2023. 66.4% is the average percent of applications processed.
Karen, I'm sorry to stop you, but should I be seeing the website now?
Yeah, you don't see it?
Okay. No, I'm still seeing your PowerPoint. Sorry. I thought you were still kind of, I still see yeah. Sorry.
That's okay. And I'm not sure exactly how I do. Maybe do you see anything?
Oh, there we go. Okay, yeah, now I'm seeing the scorecard. Now we're good.
Okay.
So could you maybe just pick it up from that point?
Perfect.
Okay, great. Thank you.
Yeah, thank you. Okay, so we are in the redesigned scorecard, and this looks slightly different from folks that might be familiar with our scorecard. We have lots more information under about, but if you want to get into the metrics of things, we still have our different pillars. There is a kind of quick way to navigate into the measures. We have all of our background information. It's just called program characteristics, again, based on user feedback. So we've got different sections on care delivery, data to support program improvement, enrollment and eligibility, and expenditures. And we've got our other two pillars: federal and state program administration and healthcare performance. I'll demonstrate just one quick measure. So there's a search button here. I've already got it plugged in, and it pulls up Medicaid Magi and CHIP application processing times. You can quickly see the key metric, which is right now for the latest data period, January to March 23rd, 66% is the average percent of applications processed within 7 days. If you want to have much more information on it, you just click into the measure, and once we're here, you can look at there's this national tab, a state level tab, and then tons more information, again, reflecting what our users wanted to say, which was we need all that, juicy detail about the measure, and we want to be able to look. So this is just kind of a visualization that it drops down on. So there's a chart view. You can also, there's a table view as well that I won't demonstrate, but again, based on the feedback, here's some across time. So you can play with the time frame. You can pull out a key metric because you want to know. If you touch on a button, again, additional information, all speaking to the ability to play around with the data a little bit more. And then finally, you can download it into a chart image or a CSV. All information that we got from our feedback groups about how exactly folks wanted to navigate and better understand the data. So I will get back out and successfully navigate back into my last slide for my PowerPoint. So again, I think what we've learned through all of this is that we wanted to be able to leverage the key data that we had in a way.
Karen, I'm sorry, we're back in presenter view again. It didn't
Okay.
like it again. Sorry.
That's okay. Okay.
Great.
Okay. So I will move us back into the last slide that I wanted to share. We did the quick walkthrough. Again, we've got some key features that we've added to facilitate the use of data, including the new measure pages. There's also lots of different extra filters for methodologies once you get in there. We're not releasing the scorecard until December of this year, so you've got a fresh preview. We've got different visualizations that we've added this year. But again, I think what the takeaway that I wanted to share was we have lots of different Medicaid and CHIP data, more than we have had over the past decade, available to us through and most easily accessed through Medicaid.gov, but through our DQ Atlas, our child and adult Corset chart packs, through the Medicaid and CHIP scorecard, through our performance indicators. There's so much information available for CMS and for our state partners and for others to really start thinking about how to start piecing together the Medicaid story. And what I wanted to share was, good data is fantastic, but good data and content doesn't always equal a good, positive user experience. And we've learned that because we ask people, can you find information? Do you actually know what we're trying to say through our data? So lots of great ways to get different types of feedback, whether it's through advisory groups like our wonderful NAMD advisory group, or through setting up interviews or small groups with folks that use the data or may not, which is always really helpful. But again, continue to evolve your dashboard reporting tool based on what people need. And that ultimately really helps you to know that you're telling your story in the way that makes the most sense. Thank you. Oh, and my final slide is my information, and that's included in your packets as well.